Yeah, and then if people join, that's fine, isn't it? Okay, let's start. I know we had quite a few more that had registered, but let's see. It is cold out there. Maybe people are still warming up, but I'm sure they can join us. So thank you for those of you that have joined us. We're going to start now. We are recording, so if anybody's got any objections to that, please let us know in the chat. It just means that people that weren't able to attend can listen back to the recording. So those of you that don't know me, I'm Kieran Hewitt. I'm the research lead at CMHP, joined by Karen Shuker, who is president of CMHP as well. So good evening. Really appreciate you taking your time out of your kind of evening to join us. So this is a webinar to discuss the joint CMHP and Pharmacy Research UK Research Award that we launched this week. So we're going to go through kind of the application process, a little bit about the award and what it includes. So we've got our colleague Desh from PR UK talking about that aspect of it, and then we're really pleased to have a couple of our previous awardees here this evening that are going to talk to you about kind of their experience of the application process and why they applied for this particular research award. And then at the end, we will have some time for questions and answers if people have got some additional questions that haven't been answered throughout the session. And I'll try my best to finish on time so you can all kind of get off and get on with your evenings. So we'll launch it straight in that case. Desh, I'm going to firstly hand over to Desh Mofidi from Pharmacy Research UK. Thank you.
Thank you, Kieran. I'm going to just share my screen. I have a slide to share with you all. Okay, so hopefully you can see that.
Yep, we can see that.
Thank you. All right. So we're delighted CMHP to offer research funding for CMHP members to undertake pharmacy-based research into mental health. So I'm going to talk a bit about the focus of this scheme. I've listed there the kind of areas that we are accepting applications in. We've purposed fairly broad. We want to encourage as many applications into mental health research relating to pharmacy as possible. And we are very happy that we've had a couple of grant holders from this scheme who will be presenting their research later on and giving some tips as well. But essentially, it's based on pharmacy practice research into mental health. This can include substance misuse. It could be relating to pharmacy services for mental health, such as in community pharmacy. It can be around medication or prescription policies for those who mental health, or how we can manage potential substance abuse or misuse of medications. It could be around, as I said, prescribing decisions and any side effects of any like medication. So any relating to linking pharmacy and mental health together that impacts patients' lives is really what we're keen to focus on. Now, each proposal limit is up to £20,000, and this year is a rollover. We can fund up to 2 proposals at the full cost. We could even fund more than 2 if not the full amount was being requested. So in terms of how we kind of make these funding recommendations, it's fairly flexible. We're very much response mode, which means we see what applications come in and the panel will make a decision based on the strength and quality of the applications that are submitted to us. So I'll move on to the next, and I see, Karen, someone's in the waiting, perfect. So I'll move on to the actual application process. We follow the standards of peer review that's set by the Association of Medical Research Charities, of which PRUK is a member, which means the application review process is fairly robust. So when an application is submitted, it undergoes an initial kind of scrutiny check. So this is done by myself at PRUK and also Kieran at the team at CMHP to make sure that the proposal, the information is complete and it generally fits the scope and remit of the call. Once it passes that initial check, the application will be assigned to 3 members of the panel. So this is one scientific member of the PRUK panel, a representative from CMHP, and also a patient and public representative of the PRUK panel, who is assigned to each application. The application is also sent for external expert review, so external peer review, of which we require a minimum of 2. So we tend to seek experts who are familiar with the subject area or familiar with the methodologies being employed, so we can get as robust a review as possible and as much feedback as possible that will help the panel to reach and discuss the application further when they meet in June normally, to discuss those applications and determine whether the application is potentially fundable. So once that's done, the proposal will be discussed at the June meeting following a shortlisting scoring process. And then if the application is successful, there's a funding ratification that's done usually in July just to sign off the process. Now, this year, something a bit new, which we're introducing funding in tiers. So I do want to say from the outset that these tiers are not a prescription. We're not very strict on each application having to fall under or meet these criteria. This is more intended to help support and guide applicants in putting together a proposal depending on the amount being requested. So, for example, for proposals up to £5,000, these would typically we would expect be at the very beginning of the trajectory to patient benefit. So while we still expect PPI and patients and public members to be involved in developing the application, it's really to gather data that could be useful for further research down the road or a larger project. So proposals up to £5,000, we would expect to address those kind of areas. The mid-range ones that fall between £5,000 and £10,000 are really, we would expect to address a research question, employ some research methods to address the question, and even potentially be recruiting participants to do so. And again, it would be to inform future research, even potentially policy or practice, depending on the nature of the research question and methods, etc. And for the higher tier, which is those requesting more than £10,000, we really do expect now that the actual project would be closer to realizing patient benefit, whether that would be through impacting policy or practice, or even addressing further investigative research that would lead to a project grant, for example. So essentially, the more money being requested, the closer the project would be to impacting patients. So that's what we would expect. Again, our panel are very conscious of the fact that we would expect mostly early career researchers or those fairly new to research to be undertaking and applying to this scheme. So the panel are conscious of this, and they're also aware that they're aware of these funding tiers, but they're not going to have it as a strict marking criteria. Again, as I said, it's mainly for applicants to use it as guidance on how to put together a proposal. And we've just used the amount being requested as a kind of framework of how to piece together your proposal. So in terms of the timeline, we launched on Monday. So we launched slightly earlier than usual. We usually launched the round in January, but we wanted to give applicants a bit more time to think and develop their application. So we've launched on Monday, and the deadline is on the 26th of March for this scheme. So what happens once that deadline passes, as I said, applications will be reviewed between April and May, and it will be discussed in the June panel meeting, and applicants are towards the end of July of the outcome of the proposal. And if you are successful, then we will contract the project during August and September, typically. So you can see, hopefully, there a rough overview of the structure of the hall. So this is just to help kind of visualize it a bit more. You have your application goes to external peer review, and it is internally reviewed by members of our panel. It's discussed at the meeting, it's ratified, and regardless of the outcome, we always offer feedback to applicants, as much feedback as possible. It's usual, from my experience working for larger funding bodies, there's usually limits to how much feedback is offered. But at PRUK and CMHP, we really do try to give as much of the panel's feedback as we can. We do signpost to extra resources in case it's beneficial for applicants. And I know that some of our panel members are even happy to meet with applicants to discuss further where they can get support and what help is needed. So I'm going to touch upon this briefly because I know Natalie and Sean will probably be more expert and talking about this than I am. But essentially, your application is your selling point. You really need to think through not just your research question, but the background literature to support and justify why you are investigating why you are investigating the area you are. Your research methods need to be relevant. So these are the areas that typically panel members tend to report are pitfalls in applications. Usually, applicants don't really think through the appropriate research method, or they don't consult with an expert in that relevant area. So please make sure that when you develop your proposal, you have a solid, concise literature review and a background to the problem. You've thought about the research methods, and you've clearly explained why that particular method is most suitable to addressing the research question. Please consult with your supervisors. Make sure you think about what other experts might be beneficial to add to the supervisory team. It's got to be easy to read. And one of the best ways to make sure your application is easy to read is by consulting patients and members of the public from the outset. We're very conscious we don't want PPI to be tokenistic on add-on. It's got to be fluid throughout the entire proposal, from developing the research question all the way through to dissemination. They are an integral part of the process. Now, for further support, I know the Royal Pharmaceutical Society have their website where they have kind of support for regards to research and things to think about. They also offer research support sessions. I'm not sure whether they're still offering this. I believe they are, but it's worth checking on their website. As an NIHR non-commercial partner, PRUK benefit from applicants to PRUK benefit from free access to the NIHR's research support service. We recommend all applicants contact the NIHR, where you can discuss your application. They'll help you to think about what things you need to consider when putting your bid together. And you'll be able to send them the application form. They can walk you through the steps, and also network with your supervisors, get in touch with people who have already been quite established in the area so that you can get as much support as you can in developing your application. I'll leave that for a moment for the benefit of the recording. So you have my contact details, and there's our X handle and CMHP's X handle as well. I'll stop sharing my screen now. I believe there's a Q&A in case anyone has any questions later. But thank you very much for your attention.
Thank you, Desh. That's really comprehensive and detailed, and hopefully drives home kind of the reason that we work together collaboratively on this, and the fact that now we have the tier system, it might encourage more people to kind of start off with smaller pieces of research as well. So thank you. There are no questions as yet, so I'm going to hand straight over to Natalie. So Dr. Natalie Ware, who is community pharmacist, I believe, by background, and works at the University of Strathclyde, and is one of our previous awardees for this particular research award. That's going to talk a little bit about her journey, I guess. So Natalie, over to you.
Thank you. Just give me a wee second to sort out my screen. There we go. Hopefully you guys can all see that now. So yeah, thank you very much for the opportunity to present. I'm just going to give a little overview of my experience of the funding, getting the application together, and some hints and tips which may help you. So for my funded project, I was looking to develop the evidence base for community pharmacy depression services. It involved a systematic review and an e-Delphi consensus exercise, which is essentially a series of questionnaires to get people to agree on what a community pharmacy depression service would ideally look like. So first of all, why did I choose the Pharmacy Research UK College of Mental Health Pharmacy Award? So I do work in a university, and I've been trying to get funding for a while to develop pharmacy depression services. And I kept getting knocked back. I kept not getting the funding. And quite often, this is the response that I was met with. The funders were not convinced that mental health services could be delivered within community pharmacies. which I think reflects maybe two opinions. One, perhaps a kind of outdated perception on the role of pharmacy, and also perhaps a perception that mental health is somehow different from physical health conditions. And I knew that actually, because this project and the money is funded by the College of Mental Health Pharmacy and Pharmacy Research UK, that would be the kind of place that would be convinced and would agree with me that yes, we should have pharmacy and mental health services. So it absolutely aligned to the area that I was interested in. And it's excellent to see from Desh's presentation that actually the scope of what Pharmacy Research UK and the funding is interested in is actually very, very broad, which is nice to see. So another reason why I went for this funding is because once you have a look at the application form, you will see that the form really encourages you to think about your mentorship and your group of people that are going to drive you to do this research. Research should never be a one-man band. You always do it in a group, and it forces you to think about who are your mentors, how are they going to help you, what are they going to help you with. And as you can see, I had a fantastic group of mentors, different professors, academic researchers that supported me on this project. And what Desh mentioned about making sure PPIE, so patient and public involvement, isn't tokenistic, very much came through in the application process. When I was developing the application, I had people with lived experience of depression develop it with me, say, actually, this would be a good research idea, that would be a good research idea. And during the application process, I was challenged to say, oh, you actually don't maybe think about the diversity of your patient and public involvement. And it really strived for me to look out to other charities and other types of people to involve. So I had a really good positive experience of that. Another reason why I chose the award is that £20,000 was pretty much exactly all that I needed in order to do a systematic review and a Delphi. Some of the kind of health services research or social pharmacy research we do actually isn't that expensive. I spent most of the money on a staff member to do some of the research with me because I was a full-time lecturer at this point. So I hired somebody at the university to do a little bit of the work, but the costs are quite flexible. I also used the cost to pay for software. I paid for the participants in my research project to say thank you for their time. I paid the members of my project advisory group, which included people with lived experience of depression. I factored that into the costs. And it also included costs to do attend a conference as well. So basically the money was enough that I could do what I wanted to do, and it wasn't too much that I'd be sitting worrying that I'm sitting on a budget of £20,000. It's quite a nice manageable quantity of funds. Now, things that I considered during the application is I realised that it was very thoroughly reviewed by the members of the panel that Desh mentioned, which is a real strength of the application process. I took a long time to develop the application. You have to really explore the literature and understand the gap that your research addresses. You have to design a study to as much detail that you actually know how much it's going to cost. So it really needs to be polished. And a place that as soon as you get the money, if you're successfully funded, you can do the project straight away. So you do need to put a lot of effort into it. And what the application also made me do was really force me to think about my future career, because there's a section on it that says, how is this going to benefit you? How is this going to help you in your career? Why do you want to do this research project? What's your next stages? So it's actually an incredibly useful career trajectory exercise from my perspective. Some hints and tips are that you absolutely must find an academic mentor. You're not an academic at this stage. You're not, an expert in research. You're doing this to develop your skill set. So you need to find somebody out there that's done this before, that's done research. Maybe they've published papers. Maybe they're an academic in a university. Maybe they're working in the health service and they've got a PhD. You must find somebody that knows what they're talking about, because probably your first idea, your first proposal, your first idea is likely to be flawed. There'll be something that can be improved. Maybe it's too ambitious. You think you're going to do an RCT on 20 grand, or you've maybe not realised the work's been done before. So trust me when I say there'll be things that you can improve, and an academic mentor will help you do that. If you don't have an academic mentor, just email people. Find researchers, lecturers that do research that you're interested in, and email them and see where the relationship develops. I would definitely recommend you bounce your idea off as many people as possible, including members of the public, friends and family, just to get other people's perspective, to challenge you and embrace that criticism. Embrace people saying, have you thought about this? Have you thought about that? you really want to know the limitations of your research before you start conducting it. So really embrace that criticism. As pharmacists, there's actually some evidence that we are perfectionists and procrastinators. So I would say try to overcome the fear of the blank page and just write your ideas down on paper as soon as possible so you start thinking about it properly. You have to make sure you read the literature and show that actually there's evidence that shows what you want to do is beneficial. Or maybe there's no evidence and this has not been explored before, but you really want to construct an argument to convince the panel that your topic is important and interesting and you're passionate about it. A few little practical things is I would make sure that you recommend reviewers. That part of the application process when I did that, you could say, I recommend this person at this university reviews it. And that can be really useful if you find people that have got strengths in the type of project that you want to do. And I would also make sure you understand your department's research submission process. So at the university, there's a really stringent process for submitting grant applications. And the health service is probably much more different, depends on where you work. So try and figure that out early on because it will likely be more convoluted than you would expect or hope. What I would say for me is I absolutely loved doing this project because I designed the idea. I've done a PhD and I've learned that I love the process of research, but actually coming up with my own idea and focusing on that meant that I was working on research that I love the topic of, and it has benefited me. And I am certain that anyone that gets this funding, it will support your future career, whether it's thinking of RPS portfolios, maybe you want to get into academia, maybe you really like research, whatever it is, I am certain that you will get something and learn from it. And these are just some of the things that I've done since it. I've joined a mental health network programme. I've now built more of a UK network with the College of Mental Health Pharmacy. I've got a couple of PhD students that are following on the work from me. So I have had like a whole list of benefits and I'm certain others would too. That was all from me. I am very happy to hang on to the end to answer any questions anyone may have. So thank you for your time and thanks for listening.
Excellent. Thank you, Natalie. I've been jotting furiously down some notes because I've learned a lot from that session. And I think some of those real kind of pearls of wisdom are going to really come in handy. So thank you for that. I'm going to collate any questions. I'm sure some of us have got some as well for the end of the session, if that's okay. And we'll move on to Sean and then we'll take all the questions at the end, if that's okay. Thank you very much again. So Sean, if I can hand over to you to give your insight and your experience, please, that would be great.
Yes, I'll just work out how to use Zoom. Can you see some slides?
We can.
Good. Okay, thank you. Yeah, so thanks for giving me an opportunity to come and talk about my experience of applying for one of these awards. I think me and Natalie were asked to come and give the talk, and we didn't coordinate what we were going to talk about. And I'm delighted to say, Natalie, that I'm similar lines, but I think I've got some different hints and tips as well. So hopefully it's it's not a carbon copy, and actually there'll be some other stuff to add. So just to give you some background, I'm a hospital pharmacist by practice, and I work at the University of Leicester. And my plan for the next kind of 5 minutes or so is to give you a bit of an overview for the project that I applied for and obviously got some funding for. Talk a little bit about the application and highlight maybe kind of a few key areas that maybe before I went through this process I thought were less important, but then realised actually they're really important. And then finish by maybe sharing some hints and tips or things that I think are hints and tips anyway for putting together a good grant application. So my proposal was to develop a questionnaire. So the questionnaire was to measure the behavioural determinants of developing antipsychotic medicine-induced metabolic side effects. So I am not a mental health pharmacist by background, so there'll be people in the room here that will know far more about this than I do actually, but I thought it was good to start with giving you some background and context. So yeah, relatively speaking, that the chances of developing a severe mental illness are quite high. We know that antipsychotic medicines are very effective at managing the symptoms of SMI, but they come with lots of side effects. One group of those side effects is metabolic side effects. And the really unfortunate thing is we know that the more effective the medicine is at treating the SMI, actually the more likely you are to develop these metabolic side effects. So it's kind of yeah, it's a really horrible situation that patients end up in, where they have to choose between kind of physical health and mental health. And these side effects come through a combination of physiological mechanisms, but also behavioral mechanisms as well. So the medicines are causing changes in people's behavior that we then know lead to them to develop metabolic side effects. And currently, so standard practice at the moment is to monitor and deliver interventions for those kind of physical mechanisms. And there's not a lot looking at these changes in behavior and monitoring those changes in behavior and trying to do something about them. So that's what this project was all about. And a bit like sort of Natalie said, I think this probably isn't the kind of project that I could maybe have gone sort of straight to NHR for. I think it just wouldn't really have pushed their buttons. It's quite out there, but I think, yeah, PRUK and College of Mental Health Pharmacy kind of took a punt on me and the project, I think, and yeah, hopefully it was worth it. So the plan for the 18-month project was to develop and validate a tool, a questionnaire that could be given to patients when they start taking an antipsychotic over the first few weeks and months to measure any changes in determinants, either things that cause these changes in behavior. And the idea being, if we can start detecting when patients' behavior changes, we can start delivering targeted interventions to try and stop those changes from becoming routine. And I proposed 3 parts to the program of research. So the first thing, if you want to develop a questionnaire to measure someone's determinants, you need to know what those determinants are. So we started with some interviews with people in the first few weeks and months of taking an antipsychotic so that we could find out what was going on. The second phase was then to turn what we learnt in those interviews into questionnaire statements. And then the final thing was psychometric evaluation of the questionnaire to see whether it's accurate and reliable, because we want to use this in practice and in research. So that's kind of an overview of what I proposed. I wanted to now move on to the application and probably spend most of my time talking about the application. So to this particular application, and I think all of the PRUK ones are modelled on, or at least they seem to be, on kind of NHR grants and fellowships, which actually I think is really good, because those of you thinking about down the line applying for then an NHR grant or an NHR fellowship, you've kind of been through a very similar process. And actually that review process that Dash outlined is also very similar to what happens when you apply to the NHR. So this is a really good opportunity to get some experience of going through that process. And that in and of itself, for me, has been incredibly valuable. And I don't think I could have gone on to get subsequent NHR grants without going through this process and getting that feedback and getting those knockbacks, but then putting in better applications next time. So I think even in it itself, the process of putting one in is really valuable and really enriching. Examples of sections that I think are really important in the form, but aren't necessarily kind of the main ones you think of. So like, what are you doing in your background, are things like your co-applicants, collaborators, and mentors. And Natalie kind of touched on this as well, and just how important these are. And it can be really helpful here to think about, obviously people who are going to support you kind of clinically and methodologically to carry out the research, but also thinking about people who might be able to support you practically as well. So I added a couple of people on, because I'm not a mental health pharmacist and I don't work in a mental health trust, but I knew I would need to recruit patients via these trusts. I added some people on who were senior pharmacists at those trusts. So the kind of the buy-in for them is they get to be on a grant, but for me, then I've got an in into those trusts to recruit participants through. So kind of it was that kind of symbiotic thing. But I think that was able to then reassure the panel that actually we'd really thought about how we were going to recruit our participants. So I think that was quite important. So thinking maybe mentors and stuff are really important, but what network are you going to need to access as well? And then the other thing around co-applicants I think is really important, and is now a requirement when you apply for NHR. I don't know if it is for PRUK yet, is we actually had a PPI co-applicant on the grant as well. So we had a PPI team, but somebody who was also a co-applicant. And having them as a co-applicant, I think really signals that their expertise is kind of just as valued as the other people on your team. And sort of having them on there, I think, again, probably satisfies the panel a bit more that you're kind of really serious about having someone with lived experience kind of driving the research. I don't think it's a requirement. You can correct me, Desh, but I think it's probably coming because it's there for NIHR now as well. And I've highlighted these next few sections because, as I said earlier, for me, these are the ones that probably when I started writing grants, I didn't necessarily spend as much time on as I should have. But now I actually spend a lot of time on them. So things like benefits of the proposed research, that's kind of one of the sections. And actually, when you have to sit there and really sell the benefits of your idea and really kind of justify why this is the thing that should be funded, um, it makes you refine your idea, but I also then end up going back to other sections in my grant and making sure that they then align with all the benefits that I've talked about in that section. So kind of I don't leave that till the very end like I used to. I now spend lots and lots of time writing that section, making sure that section is really, really tight and really, really refined. And I think that's kind of really important. And the other bit that I've kind of highlighted there is the value for money bit as well. And I think that is really important for any grant, but particularly a grant like this, and probably your opportunity to really sell the other kind of added value stuff that your proposal brings. So kind of as an example for mine, I had a PhD student at the time who was doing research along a similar topic to this one. And one of the things that we talked about in the value for money was that they would do some of the data collection and the analysis. So that wasn't something that PRUK and College of Mental Health Pharmacy had to pay for. So it was kind of added value for them because they were still getting that data and those outputs, but they weren't paying for them. And I think it's really important to sell if there is anything like that, but you might not even think is added value, but make sure you put it in if you've got stuff like that in there. And sort of people have talked already about peer review and how important it is, and absolutely engaging with the research support service is important. Engaging with methodological experts and kind of clinical experts is important. But probably the thing that I've learned relatively recently that's also important is the panel won't necessarily be experts in exactly what you're putting forward clinically and methodologically. So it can always be really helpful if you've got someone that maybe isn't in your exact area or doesn't do the exact same stuff that you do, because if they can review it and go, yes, I understand it, and yes, I think that's a good idea, then I go for almost like your lowest common denominator, and I've got someone who I always go to and I send it to him, and if he understands what I'm talking about, I know it's okay. So I'd really recommend also just going for someone who can give you that kind of critical, quite naive review, because I think if they understand it, then when it goes to the panel, some of whom won't be experts in exactly what you're doing, then you can be confident that they're going to understand it as well. And then the final thing is the development side of it. And I see kind of PRUK and College of Mental Health Pharmacy as investors in people as much as in kind of this research. And so I think it's really important to sell how this is going to develop you and kind of your team and your career. And it's also, I think, about thinking outside the box. So if you have costed in any training or anything formal, then talk about that. But also, what else can you talk about? If you're working with world-leading mentors in a particular area, then bring that into that section and talk about how they are going to help you develop. Where you're employed, is that going to happen by doing this? You're going to get more out of the development opportunities there as well. So really, I think outside the box, kind of for all these sections, I think is kind of important. And then the final thing is, just some kind of tips that I've got. So I touched with the first one already. If you're thinking of recruiting participants via the NHS, be that kind of patients or clinicians, I think one thing that panels are always wanting to check is this feasible? If we give this money, will this person be able to achieve this? And so one of the things that I did before submitting the grant was I kind of found the 4 hospitals that I thought I was going to work with and said, look, this is what I'm planning. Do you think you'd be able to do this if I worked with you? And kind of worked through some numbers. And then I wrote about that in the grant itself so that I could really reassure the panel that I can definitely do this. I've spoken to these hospitals, I've basically got them on board. I think Dash will be sick to death of me and others talking about NIHR CRM portfolio adoption, but I think it's really important. So one of the benefits of applying for money via PRUK is you get the infrastructure of the NIHR CRN behind you. And that's really helpful when recruiting people. So make sure if you're recruiting via the NHS that you build the fact that you'll use that avenue into the application. And it probably wouldn't hurt to kind of mention in the application that you'll go via the CRN to do these things. I kind of touched on the PPI co-applicant already and the range of people to peer review. But finally, if you've kind of never written a grant application before, I'd really recommend seeing if you can have a look at some examples. They don't even have to be this exact award, but they give you a flavour for kind of the level of detail in each section, you know, how much detail to go into. And the final thing I would say is I learned a long time ago that grant writing is an art. And what you're trying to do is actually sell a problem that needs addressing and an idea to address it. And I think it's as much about marketing your idea, you know, yourself and your team, as it is about kind of putting across the kind of the cold science and the cold methods as well. So yeah, enjoy it, think of it as an art, as something that you sell, that you're passionate about, and yeah, good luck. And I've put my email address there. I'm really happy, yeah, for people to reach out. When you said that there were going to be 50 people here, I'm probably not happy to have 50 applications to give feedback on, but there's not as many people here, so I'm really happy to yeah, to support in any way I can as well. Thank you very much.
Sean, that was great. And as you said, Natalie, and your kind of tips and your pearls of wisdom were quite well synced. So I'm not quite sure I believe you when you said that you didn't collaborate on it. But if that was the case, then that is a lovely coincidence. So thank you very much. Really, really informative. Desh is that to go. He has put it in the chat. We did know he had to leave. I think he had we kind of timed it around the fact that he wouldn't miss the whole session. So thank you for that. Okay, I'm conscious that we don't have most of the people that registered for this evening, but like I said, I'm really pleased that we're able to record it, and we will most definitely be sharing it on our CMHP website for those that couldn't come, and for other people as well. So I'll just pause there to see if anybody, any of our attendees this evening do have any questions. Either for myself, CMHP, or for Sean or Natalie about their perhaps their individual research projects or the process at all. No, I've got a question, while other people that are clearly very shy this evening are thinking what they can ask. But Natalie, just first one's for you, just in terms of because you know you work within a academic institution and a university, and one of your recommendations was obviously, you know, find your kind of peers and people to help support and advise. What would you say to people that maybe don't work in that environment and aren't necessarily affiliated with a university? You know, how can they sort of if they don't have those contacts already, what would you kind of recommend to them? How would they start?
So I would say the first thing probably is to link into your NHS Health Board or Trusts, education and training leads. They tend to link in with universities, so they might have some contacts for you. And actually, there's usually quite a lot of pharmacists and different health boards and trusts that have got a PhD. So chat to them. Anyone that's done some research in the past, the chief investigator, has a PhD, has something published, is a good person to bounce ideas off. They tend to understand the academic process. And are quite good at critiquing ideas and maybe the argument that you're posing for your research. So I would definitely link in to board and trusts, education and training pharmacists. I also believe in cold emailing people. So have a look at the universities around you, have a look at the academics, you know, do a little snooping, do a little bit of spying, find out the research interests. And just email them, saying you're interested. Pharmacists tend to want to help people. We tend to want more pharmacists doing research. So you'll tend to find somebody that's like, yes, fantastic, delighted if another pharmacist wants to do research. And also, it actually doesn't have to be a pharmacist. So if you come across a psychologist, or a sociologist, or a cardiologist, whoever that's interested in your topic, just email them. And I guess that's all you have to do, is go out there and start building your network.
Yeah, excellent. I think it's a case of don't be shy and just get out there, really. So not a totally unrelated question, Sean, something you might be able to answer. So, and again, both of you have kind of come from maybe that sort of, or you've got that natural sort of inclination, that experience already around research and academia. Most of our communities, most mental health pharmacists will probably be kind of patient-facing, clinical, largely, kind of at least 80% of their time within either a ward or a community mental health team setting, and they'll be working kind of within that environment. And I guess we want people to, be interested in research, and we want people to sort of, get on the ladder really. So if you don't have, again, that experience, it can be quite daunting. So, as a hospital pharmacist, Sean, how did you kind of get into research, and what advice would you give for somebody that's never dipped their foot in research before?
Yeah, I guess there's two routes. So my route was sort of, yeah, probably the more traditional, went to did the PhD and kind of stayed largely in academia with a small amount of clinical. But I think the really nice position to be in, I think if you're kind of really embedded into clinical practice and you want to dip your toe in, is academics are always looking for research ideas. So the more time we spend not in practice, actually, the less ideas we have in terms of what needs addressing. And so I think we are always, and Natalie, I'm sure agrees, we're always looking for people to reach out and say, I've got this idea. Clinically, I'm not sure how to get it off the ground or where to go. Academics would always be open to kind of working with you. And I think this award is a really nice award, actually, and to do that, because you don't have to be doing a PhD to get this award or a master's. It's something that you can do under somebody else's mentorship and still do it whilst practicing as well. If you can negotiate some time from your work to do some of this research for a few hours a week with an academic mentor, then I think you could do that, and that could be your bridge into doing something else. I'm thinking about all of the kind of NIHR clinical academic awards, and they're designed, or they're more and more designed now for non-medical professionals like pharmacists, but all of them generally still need you to have some research pedigree, some papers and things like that. And I can see that this award is a great opportunity to get some funding to work to stay in practice, if that's what you want to do, work with a mentor and get that experience and kind of see what can happen next. So it's very flexible, isn't it? So Natalie and I are full-time academics and we've got the awards, but also you can be a full-time clinician and get the award as well. So I can see how nice it is that it's so flexible. But the other thing, just to plug, there is a national pharmacy incubator, an NIHR funded national pharmacy incubator led by Devi Bhattacharya at Leicester. And its sole role is to support pharmacists and pharmacy technicians and pharmacy professionals to do more research. And so if it's okay with you, I'm going to put the link in the chat. It's actually hosted on PRUK's website. And our kind of mission is to really drive more pharmacists into research. And there'll be resources and networks and contacts and stuff coming in the next few months and years with that as well. So that would also be kind of a really good place to start. Look at the incubator.
Great, thank you. And I know there's certainly a couple of mental health pharmacists that most people will know of that are kind of have collaborated with the incubator there. So yeah, that's actually a really good shout. I think Shiva's question in the chat, you may have answered that, but I don't know if Shiva, you want to come in. So the question is, how did you start your experience with research? And I guess that's partly the question that was asked. And would you recommend a bridging masters or an MRes first, perhaps? Hopefully I've articulated that question correctly, Shiva.
Yes, you did. Thank you. I was thinking more before jumping into PhD or doing a full research project that you're leading on, would you recommend any sort of, I don't know, a bridging masters or something where you work part-time clinical, part-time working on the research for about a year to become more familiarized with the process before jumping into something bigger?
I would say it's completely your preference. I went from pre-reg / foundation year to PhD. I didn't know a lot about research. All I had was the enthusiasm. So I fundamentally believe that you can do a PhD without an MRes, without an MPhil. It might be a little bit harder if you're doing it part-time and working clinically, but you absolutely can do it. I know plenty of people who do it. You would maybe do an MRes if you wanted to, if you have the time, if you've got the money, if that's, you know, what you're really interested in, but you absolutely don't have to. You can go straight to PhD. Lots of people have done it.
Yeah, I'd agree. Yeah, you definitely don't need to. I'd say probably I see more and more people doing them these days, particularly if they're going down the kind of the NIHR route later. I think to get kind of an NIHR funded PhD, I think it often helps. Either you've been in practice for quite a long time and in that time kind of amassed quite a few papers and things like that because you've kind of just collaborated lots and lots. So I definitely see more and more people kind of doing MReses and stuff now, and it can be a nice thing to dip your toe in if you're not really sure that you want to go down the PhD route. And of course, I guess nobody's saying you have to actually either. You can be a clinical academic without a PhD if you're kind of mainly clinical based. Yeah, as Nancy said, I think it's up to you and what you want out of it. Yeah, I didn't do it either. I similar to Natalie, kind of went straight into the PhD. Yeah, it's totally up to you, basically.
Thank you.
Any other questions for anybody? No. I mean, as part of a kind of large part of our annual CMHP conference is kind of the poster and the oral presentations, and the amount and the number of abstracts that we get kind of in preparation for that is really great to see. A lot of those tend to be service evaluations and service development projects. Some are kind of original research. So could it be that, I guess, on the back of something that you have started in a clinical environment, you know, having done a kind of QI project or a service evaluation, kind of, you know, want to delve deeper into that particular subject matter, and take it that one step further?
Yeah, so I completely agree. I think I don't see a big distinction between service evaluation and research. If it's going to benefit a patient, if it's done to high quality, if it can be published, then absolutely you should be looking to get funding to do that. I think that as long as you have an idea that's going to benefit patients, then you should go for it, regardless if it's considered quality improvement or service evaluation. As long as it's done robustly and well, you should go for it.
Yeah, I agree. The first publication I got for my PhD was actually a service evaluation, and it's actually still my highest cited paper. So nothing wrong with a service evaluation, you know, as long as it's reporting something novel, you know, which it has to be publishable. Yeah, absolutely, they're really important.
That's really, really good to hear. And hopefully people that are listening back to this can kind of you know, feel sort of enthused by that, and you know that actually that's a really good place to start.
And I was going to mention, actually, this year we've got that change to have the tiered support. So it's not feeling like you have to come in and already have lots of research experience in the past. Actually, if you are new to research, with the tiered approach, it will provide that initial support and hopefully be a stepping stone towards building more research in your career, really, isn't it? So, well, that's the hope. That's the hope.
Absolutely, yeah. So I like the idea of kind of, you know, got an idea, speak to somebody about it, and hopefully develop that into research. That's great. Okay.
There's no other questions. I will stop
Very
the recording.
quiet.
Then.
Yeah. Okay.
I'll stop the recording, and so we can save this to either CMHP or the PRUK websites.
Okay, wonderful. Thank you. So we'll end it there. If there are no more questions, I mean, if those of you that are here, you have got more questions, you can put them through to us, and I'm sure we can forward them on. If you're members of CMHP and the chat group, then absolutely use that as well. We'll all be on there, so we can help try and answer those. There's details on our website, and you'll see, if you're on the chat group, the original advert that went out for this, with the details of the award and where you can find the application process, and also the guidance So the stuff that Desh was sharing earlier on this evening, that information is all on there, but please get in touch if the information you're looking for isn't on our website, and we'd be happy to help. Okay, thank you very much. Big thank you to Desh, who has left now, I know, but Sean, Natalie, thank you so much for your time. I've found that really interesting, really informative, and I'm sure that our communities will as well. So I wish you all a very good evening.